ICCM Conversations, the value of critical research in developing community music partnerships.
Bring me sunshine in your smile. Bring me laughter, all one. In this world where we live, there should be more happiness. So much joy we could bring to each lovely bright tomorrow. Make me happy through the years. Never bring me any tears. Let your arms be as warm as the sun from up above. Bring me fun, bring me sunshine, bring me love. Bring me sunshine in your eyes. Bring me rainbows from the skies. Life's too short to be spent having anything but fun. We can be so content if we gather little somethings we are taught to do. All day long, keep me singing happy songs. Let your arms be as warm as the sun from up above. Bring me fun, bring me sunshine, bring me love. Yay, thank you.
Thank you, Sean.
Hey, thank you so much, Sean. That's lovely. I feel like I want that to continue a little bit more for our joiners that are just coming in now. I'm going to pass over to Ruth, Kathryn and Anna. Delighted to have Dr. Ruth Currie joining us, and research associate from the International Centre for Community Music, who completed her PhD in 2020 that considered more music as being, and becoming. And I'm delighted to welcome Kathryn MacDonald, the Director of More Music, to this call, and Anna Daly, the Project Manager for Music for Health in Morecambe. Welcome all. I'll pass over to you now, Ruth, and thank you everybody for joining today.
Thanks, Jo. Thanks for the welcome and also for the invitation to join. Today we are sharing our learning of working together as a research partnership through the findings of our Working Together research report. And that report explores how value is understood and communicated across partnership working in a project called Music for Health in Morecambe. Music for Health in Morecambe is a project funded by Spirit of 2012. And it includes 3 music groups. It has a singing group for older adults. It has a drumming group with people who are accessing a programme within a local wellbeing charity. And it also includes a singing group for young people who are accessing mental health support. Today, our aim is, as part of this ICCM Conversations event, is to tell you a little bit about our perspectives of being a critical research partnership and how this is informing and being informed by Music for Health in Morecambe. But the session's also, as I've mentioned, about us all together sharing and reflecting on what we think contributes to critical research partnerships and how critical partnership working takes place through our practices. And one, I think, of the successes of today might be that there's people here who are representing lots of different kinds of partnership perspectives. And that's really valuable in helping us think together about how we move into the next stage of sharing and thinking through our own research. So to settle us into today, and I suppose to develop some kind of familiarity as a group, I'd like to kick off with 10 minutes in a breakout room responding to the question, what does critical mean to you when thinking about your community music partnerships or your partnerships? The groups, I believe, are small, so it's also an opportunity to say hello and to introduce yourself if you would like. When we return after these 10 minutes, Kathryn will share what critical might mean to More Music from the perspective of being a cultural organisation, and I'll also share my thoughts on being critical too, from the perspective of working with More Music as an academic researcher. And then we'll also tell you a little bit about how we arrived at the Working Together research project and what we're learning about music for health in Morecambe. So with that, that's all from me just now. Jo, it's over to you to invite people into breakout rooms.
I think for me with critical as well is, especially with the partnership that this is at the moment, which is a third sector partnership working with health. I think you have to be very mindful that the two aren't being critical of each other. And there is that, like you said, that understanding of what each other's barriers are when it comes to becoming that one partnership together. So as what third sector can give to what the NHS, obviously in England, can give here. And I think it's being that mindful approach that it's just not all about we need the funding and you've got the money and you need to give us the funding. I think it just goes a bit more deeper than that, and we understand each other's barriers as well, that sometimes can partnerships fall apart, but at the moment this partnership's going really well together. So for me, it's just being mindful of each other, what's going on.
Okay.
Would think of it also like a continuous self-evaluation of the process. So just checking how we're doing everything, which things are working, which ones are not, being self-critical and critical with their partner in a positive in a positive way.
I would agree with Karen, the being mindful of each other. I think that's the bottom line or basic thing that just sometimes is not evident maybe, but it's crucial for that.
Mm-hmm. Yeah, absolutely.
It's hard to capture that evidence as well. It's easy enough to capture the participants' evidence in what are they getting out of a session when they come along to it, what is it they're feeling, what is it they're taking away with them from when they've been with that 2 hours. But I think it's more than that, and it's evidencing what goes on behind the scenes that can break down a partnership in some respects. And it's all right on the rosy on the top when you go into the session room and it's a good 2 hours and we've got Sian there on the accordion and it's wonderful and we can see that everybody's got a lovely smile on their face and they're participating and they're joining on, but in the background something chaotic could be going on where they've not got enough staff in, they can't get people to man the door at the front, one of us has gone off sick, we can't get another person to fill our place for us, and I think it's all that background that we do have to be mindful of.
Mm-hmm. Absolutely. And I think I'll add that for me, it's about making sure that the goals of each of the partners is always sort of at the forefront, and that those goals are aligning. And if they're not, critiquing why they are not aligning and therefore, making adjustments as needed.
I don't know about the two of you. I find the idea of criticality quite difficult sometimes. I think as a community musician, I think often the kind of work that we're engaged in means that you have to leave that side of you outside of the room when it comes to music making in a set to a degree that I was just thinking about, some of the projects I've been involved in where actually if we're about inclusion and accessibility and encouraging and supporting and self-efficacy and all of those kind of things, that actually to what does criticality look like in that space, and then obviously like connected to the research. So yeah, I don't know whether either of you have any thoughts about that.
I'm all right. I think for me, I think I like to bear in mind the difference between criticism and critique. Like that's something that comes up in my head. because I'm quite a critical critical human being, like quite self-critical, and so obviously it has that kind of those negative connotations. But then I remember when it was at the last student symposium where we were talking about critique, not criticism, and that was really kind of a turning point for me, thinking about like critiquing something instead of just criticizing it. And I think another kind of connotation that critical research, or within the context of community music, something that it brings up for me as well is not having, it's kind of a slightly unrelated point, but not having kind of our not assuming that the work we do is always going to bring about positive results, kind of the good intentions doesn't equal good outcomes kind of thing. And keeping a critical, like having a critical perspective on that maybe is quite a good thing, because it prevents us having that kind of well-intentioned arrogance. I quite like that as a little phrase. Yeah.
Okay, Kathryn, I think we're almost all back. Yeah, I think you're okay to go ahead and take over with the next section.
Great, thank you for being here. Thank you for listening to us, and I hope you've had some interesting conversations in your breakout rooms and managed to get to know each other a little. As Ruth said, I am going to speak about why critical from a cultural organisation's perspective, and then Ruth will speak from the research point of view. Research has always been an element of our practice at More Music and ties in very strongly with our approach as a reflective organisation. We've worked with researchers over many years to interrogate different aspects of our work, all of which have been valuable in some way or another. Research is important for us to understand our work as a cultural organisation, to explore perceptions about More Music, and to understand our position and influence in this community. Research helps us to design our programme of work, reflect on how we can improve, how we can ensure relevance, and it also challenges our own perspectives and perceptions. And it can be risky. However, we value critical research, and this project led beautifully from a larger PhD study with Ruth, with the ICCM, that examined More Music and perceptions of this organisation within the West End. And so we could have looked at health and well-being, and we could have looked at the impact of music and the impact of the project on the participants. However, there's a wealth of evidence and a massive amount of academic research into this area of work. And we know about the positive aspects of music making on health and well-being. And the literature review that was part of this study gave us the confidence and informed our choice to explore the partnerships that exist, or what are the partnerships that are necessary in a community like this to make work like this really, really successful. And so that's what we've done. We've worked very closely with partners at the very beginning of this project to apply for the money from Spirit of 2012, and this has led us to a really great place. And the other thing that I wanted to say about critical, or maybe Anna wanted to say that next bit.
I wanted to add, as a freelance person who has worked alongside and in different posts for More Music, that I think the choice for critical research around their work was very brave and showed a real willingness to put their own work and their own point of view and subjective aim under the spotlight of work as well, in terms of looking for the greatest value to the community locally, and invite that scrutiny with a more objective 3D view through the critical research. So that was really appealing to me for an organisation to take that position.
Thanks, Anna. And today's really about, in some ways, for us to show some of our working out, and share some of our processes with you. And I suppose for me, critical is about finding constructive ways to look at challenging or unjust context within or surrounding our practices, as one of many ways to think about criticality and being critical. I'm informed by the critical ethnographer Sonia Madsen, who challenges researchers to think about, well, why am I here? And what responsibility do I have in this space? And in this way, it's one of many ways of thinking about positionality, which I know Jo will likely mention at the end in relation to the upcoming ICCM symposium. But when we're talking about things such as social justice or equality, or within this context, challenging health inequalities that are place-based but also representative of broader inequalities, it's about situating, for me, it's about situating what we do within a bigger picture and wondering about how projects and practices reproduce or change unjust or unequal frameworks or policies. So as a researcher, critical for me is also in that, recognising the responsibility to demystify research processes and looking at ways that academic and cultural institutions and practices inform and challenge each other. So it's about being critical and collegial and modelling ethical practices between and through our learning with each other in partnership. And I suppose for me, that includes our own learning processes, and that is significantly based on trust. And as a researcher, it's warming and encouraging to hear the kind of ways that More Music are talking about their relationship through research, because developing that trust to be able to have the confidence to critique and bring that into different kinds of spaces for dissemination is really important, and not without its challenges. So what, on the process of things that are not without its challenges but are worthwhile doing, I'd like to just take a few minutes to frame our working together research project, which we are very much have just finished and having the report made this week. So we're really delighted to be able to share this learning with you very much in real time. So I'm just going to talk a little bit about how we framed it, what we did, and then I'm going to hand it back over to you all again to think about your critical practices in research contexts. So in our Working Together research project, we drew on critical theorist Homi Bhabha and his work on third space. We did this because his idea is useful for thinking about how people work together with seemingly similar goals whilst operating within differing and quite often quite contrasting policies and practices. Third Space has helped us think about how these perspectives interact and what new ways of understanding partnerships might come through this process of learning and thinking and challenging anew with each other. Myself and More Music, as you've heard, have worked together before, and there is an established research relationship there, and I suppose an open door to a level of trust and critique. But of course, this didn't mean that the development of this project wasn't without its challenges. However, the idea of third space was helpful because through our collaborative research, it was helping us think about our own critique in our partnership together and what our intentions were for designing it as a cultural institution and as an academic institution. And Kathryn and Anna will talk about the findings from the Working Together project later on. So what we did is throughout the autumn term of 2020, we worked through the process together of what a good project would be and why. And we thought about what it might mean to be critical within our research and what specifically it meant to be critical through research in music and health partnerships. And you've heard, as Kathryn said, we wanted to focus beyond the impact that some kind of project may have on people that take part and think beyond that about the structures and processes that may legitimise that kind of learning. In the spring term, I shared a position piece with for the research for those working in the Music for Health project that we hoped would come and be part of the research. This became a springboard for the interviews that we organised, which I conducted and collaboratively analysed with another researcher, Nell Farrelly. And post-interviews, knowing how busy the partners are, and also being really wary and alert to people's reticence for long research papers. We shared the findings as a video and some questions that could scaffold us into the next phase of our project, which was an online action research event. And that was an approach we designed collaboratively at the beginning with More Music. So as a research partnership, myself and Anna and Kathryn, we met regularly to reflect back on the findings and think within the context of how their project was developing on the ground, what would be the most constructive ways to invite collaborative critique with the partnership and through the partnership. So still in the spring term, it was a very busy spring term, we held an online action research event. We used Mentimeter and discussion groups to facilitate that, and a further findings video was produced as a way to share and think together about the findings. And we've now got the report, which has been produced, and we're currently in the process of working with an animator to create a short that tells our research story and what we've learned. So sharing with you today is a step, another step towards us thinking about what that looks like and how that's valuable to whom and why. So I've just taken a few minutes to share our process, because I think what we want to do today is, like I've said, think about what it is we're doing and why we're doing it, share that learning with you, but also think about that collectively together. So it's not a clear, shiny output, but an invitation to look at what critical partnerships might mean and how they might develop. So with that in mind, we'd like to invite you to spend some more time in your groups. I hope that you have familiarised yourself in some ways with each other and will stay in those same groups. And we'd like you to use these questions as a guide. So who is involved in your critical research and why? What's important to consider in critical research through community music? And if you're not currently involved in critical research or in a critical research partnership, but you might want to develop one, who might that be with, and what's going to inform your practice to develop that? We'll spend a little bit longer in these groups, 15 minutes. And then when we come back, the fabulous Anna and Kathryn will use our research findings as a lens to talk about some of their learning.
I was very interested, Robin, when Suzanne has put in the chat that the Centre for Cultural Value work on a critical friendship model. And I think that's something that's a valuable way of working that I think we could do with a little bit more of in community music, because it's such a small circle in some ways. We can end up being quite, I guess, sycophantic, for want of a better word, but unintentionally.
Yeah, I think it's always a kind of, a phrase we've used, because although we're pointing out where there isn't evidence, we're also making sure that we're saying we're not saying you're doing a bad job on the ground, because we know that there's fantastic stuff. We're just here to make what you do even better than it already is. And you can't do that just by being an academic in an ivory tower, just saying, I know what's best for you.
So who is involved in your critical research and why?
I can go with that one as well, because it's quite relevant to the research I've just done, in a way that's a massive limitation on the research. Since I've done critical participatory action research, it was all during the pandemic, but the way I've recruited people was by essentially targeting International Centre for Music Education sites on the internet, on Facebook and stuff. So I've got loads of academics, people who work in the academy, doing this study on activist musicianship. And so obviously that means that that's the voices that I've got, right? And so actually 99, or like, an overwhelming percentage of people who are doing the sort of work I'm studying have not got involved in the research at all. And it is a sort of cyclical research process. So the hope is that the more people we get will bring more people into it. But that's left me in a position where I'm doing critical research with essentially a bunch of white people in academic institutions, which is like not really what I was intending to do. But that's sort of the limitations that the pandemic put on it. And then I was wondering what do you do with that? And I think the first thing is just acknowledging it in the actual research is like the first thing to do. And then, because it's participatory research, is try and collectively come up with solutions to how we might be able to disrupt that. And that's sort of something that is in my thinking now of how we do that going forwards.
Excellent stuff. I'm not currently doing any critical research at the moment. I'm still sort of like, I'm just on the tip, on the edge, ready to kind of like thinking about exactly which direction I'm going to leap. So I guess really the first two questions aren't really for me. But shall I go ahead and answer that third one? Because like I say, I'm still kind of like in the early stages, and I know that my brain has like gone in various different directions of where I want to go with what I'm doing, but I'm looking at sort of the value of music within communities, and you know, how that is seen by parents, because a lot of my work, just to update you, Robin, sort of a lot of my work is working with families with very young children. So I'm looking at how music is valued, and therefore how it is sort of fed back to funding bodies, and like what their idea of value is, but what the community's idea of value is, and how they marry. So this, you know, I do have already partnerships with some family intervention services sort of in the Northeast. So I think they're the people that I'll be working with, because they've got a long history of working with these families. You know, they work with a lot of refugees and, you know, families who are at risk. So, you know, working with them because of the wealth of experience I know that they will have, but also a different perspective on me coming in and doing like something creative and musical with their families. So, you know, I think I'm sort of like still at that early stages of sort of like stepping in, but I think that's kind of where I'm looking at. You know, working with people who have a lot of experience anyway, it can help inform how we move the research forward, and which sort of what our aims and objectives are. But I think definitely starting with like loads of conversations with them, just to make sure we're all kind of like vaguely heading in the right direction, the similar direction. So yeah, that's where I'm at.
Sounds really, really interesting. Look forward to hearing more about these plans. Sounds fantastic. So the critical research that I'm doing at the moment, so it's secondary research, which I think is an interesting kind of take on critical, because it's a different kind of critical. We have at the centre, we have what we call an engaged research process. So in order to shape our research reviews, we engage with the sector and practitioners through a survey, and then a research shaping event to kind of understand what the priorities are for people working in the sector, because I think academics frame questions very differently to people who are working on the ground doing the work. And it has allowed us to develop some really interesting questions kind of in collaboration with the people who come to our events. So for example, we've done a research review on the role of culture in young people's mental health and well-being. And the question that everybody wanted to know the answer to within the research shaping events was, what training do cultural practitioners receive to be able to work with vulnerable young people? Now, going to the literature, there's 2 sentences in 2 papers which even mention training, which obviously just signifies this massive gap that maybe we wouldn't have identified had we just gone for the standard, what are the impacts on well-being, what are the impacts on mental health. And it's just kind of opened a door for us to have this conversation now at a wider level, so we can. So for example, I'm writing a piece for Arts Professional that will be focused on why aren't practitioner voices heard, and try and get that narrative started. So it's through that critical research process that we're actually able to answer the questions that are important to people who are doing the work, which I think your more typical academic literature review would not feature. So that's something that's been incredibly valuable to the critical research that we're doing at the centre.
That sounds great. Fascinating.
Yeah. I guess I'm the last one there. So I'm similar to Carol. I'm still kind of at the beginning stages. So yeah, who might I develop a critical partnership with, and how would this inform your practice? So I guess it's contextually dependent as to what your research is looking at, of course, because mine's quite quite kind of historical and quite philosophically based at the moment. So I'm wondering how, I mean, this might be a question, I'm answering a question with a question, is how I might link that into my practice in a way, because I'm wanting to look at kind of the history of community music in the UK as a kind of stemming from grassroots kind of activist origins, and then kind of looking at the social structures of social movements and how kind of the community music as a field has kind of grown to the present day, and what similarities or differences there might be with kind of So I'm wondering, it's quite difficult, I think, because as Carol said, like my practice at the moment, I feel kind of, how do you say, like constrained by funding, and I mean, I've got to worry about Ofsted, and so I'm kind of thinking, how can my practice, how can I incorporate these kind of values of musical activism, I guess, into a thing that is like so tied up with like institutional, like it's Ofsteded, and that's something that I'm finding difficult at the moment thinking about.
Yeah,
I guess that's the important thing to consider, though, isn't it? Like that with community music or community music with a capital C and a capital M organizations, that they're bound by the charities can't be political, they're bound by this. So it's like, does community music have a right to write in all the books that this is a countercultural movement born from the community arts movement? Like, I don't think it necessarily does, but there's lots of stuff that happens that is not tagged community music because it doesn't have formal funding, or its funding comes from a different route, or it's part of a community development program, or it's part of this, or it's part of that, and it's got called all sorts of different stuff. From it could be hip hop pedagogy, devotional song for elder Sikhs, whatever, all this stuff that doesn't fall into this very small sort of like, crucible, which is basically stuff that Sound Sense might put in their, magazine or whatever. And it's sort of, we miss so much stuff that's like, we know is going on, but it just doesn't find its way to the sort of like top of that pyramid that we've sort of accidentally created.
That's kind of the thing.
Using a capital C and a capital M. It's like, who would be involved in the critical partnership? So with my sort of like community development hat on, when I'm doing projects, I work in asset-based community development. So I don't do any music with people. I do play music with people, but I don't set up and facilitate the group. I sort of, if someone's interested in music, I try to bring them to the point where they will start their own group, which in the context I work in, which is mostly with refugees and asylum seekers, that works a lot better because I don't know anything about the Darfurian drumming traditions that some of these people are experts in. I can't rap in Eritrean. All this stuff that I can't do. And I would really, really like to do research, sort of some rigorous research, not sort of the research that we do at work, with some of these people that I'm working with, but there's an ethical thing involved there. Like, if I was going to do that, I should really be paying them some money because it's going to take some significant amount of time. We give them, frankly, quite pitiful seed funding to start up what they're doing. And there's just all this sort of like, so, and I've got this problem with having reached people quite high up a pyramid with the research I'm doing now, but then also to go down and do the research with the people that I'm working with, it becomes a bit more extractivist, which is what I'm trying. The participatory nature of the research is something I'm trying to stop. That, like, we do research, we take it up here, it's got my name on it. Way I got published, I'm gonna, get a better job. This sort of like stuff, which is sort of, why are you doing the research? I think is the like one of the main questions, isn't it? And like, yeah, I don't know, just waffling now.
No, not at all. But I mean, that answered also question number 2, what's important to consider in critical research through community music. And it is that, it's like, why are you doing it? To kind of like stop yourself and say, why am I doing this? Is this ethical? And is this, what are the reasons behind it?
Yeah, and it's like, all these things can become exploitative quite quickly.
Yeah.
Can't they? You know what I mean? Especially if you don't have a real commitment to the research being collaborative and participatory, and that at every stage of the thing. People can say, no, that's shit, get that out of my, I don't want to say that. I didn't, and so that's where I'm at with my research. Is I handed it in, for Lee and Kathryn to mark, but under the proviso to all the co-researchers, this doesn't go any further after that until we've all had a chance to rip it to shreds, because I had to write it in a certain way because there's an external examiner that's going to look at it, it's going to say all this sort of stuff, and it's just, how do we sweep some of that sort of traditional pressure, the pressure of tradition, out of our research? I don't know how, but
no, it's a good question. Yeah,
I think it's a really important question, and I think as someone who's had my head in literature for 2 years reviewing it, it is just shocking the level of researchers just not engaging with reflexivity in published papers, just not presenting themselves within the data. And I find it, really, especially in the context of a review we've been doing on older people and their cultural participation, you feel as if you don't get to know the participants, you don't get to know the researchers. And so it just, we've had 70 studies that we've read, and it just feels like you're reading the same piece of work again and again, and it is so uninteresting and uninspiring, which is such a contrast to the work that's being done on the ground and that we know is happening on the ground. And so I guess it's a question of how do we get researchers into these spaces to do research that is driven by the needs of communities and cultural organisations as well, to get to the bottom, to have more interesting, innovative research that's more fun and interesting to read.
Yeah, so I work for Spirit of 2012, which is the funder of the More Music project, and I was managing a portfolio of projects before this, which was called the Carers Music Fund, which had an overall evaluation, wasn't conducted by an academic body, it was conducted by an independent evaluator, but I think it used a lot of the same sort of principles as critical research, although that way, me making that assertion might be based on the fact that I fundamentally misunderstand what critical research actually means, so I may have had zero involvement with it and just misunderstand what it means. But from my understanding of it, I think, there were many elements of it that kind of would tick the same boxes as what you'd consider to be critical research. So I think in terms of what's important to consider, I guess the really important thing for us was always that you had some ability to be able to compare the results and the outcomes with other kinds of interventions that didn't involve music, because we were really interested in well-being outcomes, were the hopefully improvements in well-being outcomes were for participants in the projects. So we kind of worked with the Work Centre for Wellbeing on setting really robust ways of measuring well-being that you could compare across basically lots of different interventions across the country, and compare against baseline levels of well-being for individuals. So we use the ONS4 well-being measures as our kind of core of quantitative data. Just that was the main thing, I think, was just being able to compare the intervention. with others. My start point on the important bits. Yeah, go on, sorry.
No, I won't. I thought you'd finish, Rob. I didn't mean to interrupt you.
Not at all, no, I pretty much had, I think I was tailing off a little bit. So you go ahead, what were you going to say?
Well, I was just going to dip in, because the irony is I actually worked on the Carers Music Fund for 12 months. And
who did you work with?
I was on the Birmingham.
Midlands Arts Centre.
This is quite an interesting moment, actually, because at the start of this conversation, because I haven't conducted critical research myself, and I'm still an active community musician, I still very much are in the mindset of an operating community musician in spaces. So I did that project, and I'm aware of the baseline forms.
Yeah.
And I understand a little bit about the research, but you know, and a lot of this went back into our regional evaluation. It often doesn't filter through to the ground level. So sorry, just to use this example, I remember the informed consent, and the women I was working with, most of the women in my group didn't speak English. So, you know, just something like that was a huge barrier, not just in actually giving informed consent, but actually understanding the ethics and where their data was going and what was being done. And as music practitioners, there was only myself and another community musician involved at this point. And, you know, we as community musicians don't always get shared with the information we need to get shared to. And it was tricky, you know, and at the time I wasn't in research, but, you know, there was definitely a few red flag moments, and, you know, coming from working with many people in the community who don't speak English, and just normal evaluation processes, which aren't particularly critical or research or academic even, you know, how important that is for, I guess, accessible pathways for participants. And, you know, I can't really answer some of these questions because I haven't done it myself, but as a community musician, I guess it's transparency. And I mean, Ruth mentioned trust in the partnership. But, you know, when we're working with people at ground level, and community musicians are on that ground level working with people, that trust has got to filter through. Because, you know, I'm sure I'm looking at Matt, because I know you're a community musician in Germany, even though I haven't spoken with you before, and Laura, that trust, you know, I actually found that informed consent of the Carers Music Fund such a barrier to me gaining consent, to me gaining trust. It really was. It was a hurdle, and it was difficult. So, you know, I guess I would, you know, my little contribution here would be that trust and importance of transparency for everybody involved.
Yeah, I'd agree completely with that, and certainly on the ground. And the thing we're finding at the moment here, we're not working any sort of critical research partnerships yet, but we're looking to set them up at the moment, is sort of building from that, is what kind of why collect this information, and what is the correct information or data to be gathering. It's quite easy through our processes to gather lots of stuff, and you might do that by whatever's kind of easiest to gather with participants, but it's not always useful. And I think that's probably one of the interesting or important things when working in partnership, is making sure that whatever stuff we're gathering on the ground, and sometimes putting a lot of effort in to gather this information from participants, is then actually, you know, why are we doing this? There's so often, especially in Germany, when people take their privacy far more seriously than they do in the UK, there's always questions about, well, what is this, and why are we filling in this form, and why do you need to know this? And the levels of data that we're able to collect here are far less than we would in a community music project in the UK. You know, we can find out people's names. That's kind of what we can find out quite easily. and then anything else is quite tricky. But then so for me, in setting up a critical research partnership would be about what are the right things, what's useful, in terms of that partnership. So it'd be interesting maybe hear from Chris maybe about what are the things that you're looking for as a kind of measure of success, or as a, what's the thing that in this project you need?
I think there's a couple of things we wanted to see out of it. Continuity was one with people. You want to see people come. We can do the assessments when they arrive, and so 6 weeks in, but you kind of want to see how that continues. Because we're a GP practice, it works quite well with our patients coming back to see us for other reasons, but you're getting the feedback, and that's sort of, it's in a research in our own way. So that's very important to us, to see what happens as we go along. And I think we're probably involvement, I think, is the other thing as well, from our point of view. I sort of was involved in the initial setting up of this project, but then the actual running of the project was taken over by some other people, so our care coordinators who actually attend every week. So again, they get to assess how things are going. They get to meet the people. This is about ground roots, isn't it? You were saying all the data in the world when you first start a project isn't as good as actually getting some personal opinion and personal interactions. So I guess that's where we come from. Because as an organisation, we don't do critical research as such into what we do generally, but we do research into our patients and how they feel. Does that make sense?
Yeah, makes perfect sense. It's wonderful.
I have another question, because does it depend on which background the researcher is? So like here in Germany, there are not so many community musicians who could do research, because you have to explain what it is. So does it matter if we're getting a researcher more who's working in the social field or in the music pedagogic thing, or how does it influence? How good do you have to know what the department is doing, what community music is doing to do a proper research? And yes, how does the background of the researcher influences the research?
I don't mean to overspeak again. Laura, if you wanted to share, please cut me off. But I was going to pick up on both your comments actually. Is it Marlene and Matt? I mean, Matt mentioned what you're actually asking, which I think is also like really important, because I know, going back to the Carers Music Fund, I found it really uncomfortable asking certain things about employment statuses and something that might be on the fringes of someone's migration status are really barriers as a community musician working with people. And again, with the little understanding I have of what the data was going and what it was for, it's very difficult to sort of have transparency and trust with that. I've lost my train of thought as well. Sorry, Laura, was there anything you wanted to add before I ramble on?
Well, I really love the question that Marlene actually raised about the researcher background and how the researcher's background impacts the research. And again, not speaking from a partnership as such. I think that because in the last breakout group where we talked about bias being something to consider. And so I do wonder about that, but also I'm a believer that if, like in my research with involuntarily childless women, I am an involuntarily childless woman, and my research approach is I take a feminist approach to methodology, wherein as an insider, although insider has its issues too, and can definitely be critiqued. But I do think that it definitely has an impact. I guess that's to make it short. yes, I do think that it has an impact what the researcher's background is. We have 20 seconds if anyone else wants to say anything. Otherwise,
Thank you all. That was very fruitful discussion. I thought that was really great.
It was, yeah. Yeah, thank you.
Welcome back to the big room. And thank you for the contributions that we're seeing already in the chat. It's really interesting to see that people are picking up on themes that we'll touch on a little bit now. And thank you for your patience. We know it's quite a lot of information, and for us it's been an incredible amount of learning, and what we're able to do today in some respect is a bit light touch and hopefully stimulating. I'm going to share with you, Kathryn and I are going to talk you through some of the key themes that came out from the research. There's a couple that we're going to use to kind of exemplify our learning that have been really meaty and juicy for us to get into, whilst acknowledging that this is coming from the lens of our view being project delivery and development on the ground here at More Music. So the first theme we wanted to, maybe I'll just go through all four of them there. So as you can see on the slide, we've got partnership mythology was one theme, plugging a gap by plugging into existing services, the music and health paradox, and a new way of working. So these are the key themes that have been identified through the research. The first one we'd like to talk about is partnership mythology. We've pinched this little photograph from one of our early years projects here at More Music, but we felt this image kind of works with the phrase partnership mythology. It's about how you reach out, who's out there, who's in the dark, who's reaching back, whose hands can you see, who's ready to dance, who's ready to play, who's ready to partner, and on what level. But the phrase partnership mythology for Kathryn and I, when we kind of saw that in print from the first interviews, both of us were like, that nails it, that puts a finger on something that we were trying to grasp in terms of what's kind of a bit sticky, what's tricky, and also what's not the same across our three groups, because we're working with three groups and three very different levels of partnership. So as a phrase that was really useful for us and reflected back quite quickly a theme that we felt we were dealing with. And in terms of the partnership, it began at the application stage and was an emerging partnership at a local level, particularly quite key with our NHS partners, and it was identified really by our funders, Spirit of 2012. They came and visited and felt that there was potential for the arts and health partnership, particularly music and health, in our patch. And I'll let Kathryn tell you a little bit about how the partnership worked at the very early stages of applying together.
I think we had already started working and talking to people like Chris Greenwood and Angie Stokes. And then the opportunity to apply to Spirit 2012 came along, and there was great enthusiasm from our partners at University Hospitals Morecambe Bay, which is Angie, who's here today as well, and BMG, which is Bay Medical Group, which is the practice for Morecambe, with Dr. Craven and again Chris Greenwood, who's the patient liaison. And we also had a clinical psychologist from CAMS who all kind of gave much time and a lot of energy, a lot of wisdom and intelligence to helping us put that application in. And there was a real willingness from all those groups. I should mention also, I forgot to say, West End Impact, who are our other partner in this. A real willingness for the project to happen. And this funding opportunity, which actually was pointed to me by my dear friend Clive Parkinson, who is also here, and it seemed to connect with a shift in the way the local health service was moving. They were interested in moving towards a kind of more of a social prescribing model, more of a preventative kind of approach to healthcare in this community.
So that there was kind of that emerging declared partnership, I suppose. Yeah,
declared will to work together.
Yeah,
a
real willingness. So that was at the offset. And as anyone that knows that works in any kind of partnership, once you get into the groundwork and the delivery, and we were doing it across 3 different partnerships, that's when you start to go, what were our expectations? I wonder what their expectations were.
Yeah.
What's our roles? What's your roles? What's our responsibility within this partnership? How do we want it to go? Do you want it to go how we thought you want it to go? And having the space to ask those questions is really important. So when it was at delivery, that's when we were able to identify this idea of partnership mythology. That was really useful for us. And to give a small example of something that we learned through that partnership mythology label, it was, say, in some small decisions around the delivery of the project, questions, really simple questions came up about who can we include in this? Can we reach out to these people? Can we scale it up? Can we work with this group of people? And it's about on the ground how those decisions are made. And it reminded us that our first partnership is with our funders, predominantly. Spirit of 2012, I'm going to say this, but I will say it, are a wonderful, very supportive funder, very flexible, very responsive, very generous, great sounding board, and really invested in learning opportunities. So our first partnership is with the funder. We realised through one tiny decision that maybe what we thought was kind of a shared partnership wasn't as much shared as we thought, because ultimately we are the funded organisation. My role as project manager is to drive it in accordance with a particular project plan with lessons for learning in there.
Definitely.
So we thought actually the decision in this case, now responsibility to the funder and some agreed outcomes, has already been decided to some extent. So that was interesting, because we thought, is it a partnership, or how much of a partnership can it be then? Go on.
No, it's just that interesting thing that came up in the chat when you talk about, somebody mentioned the power and the power dynamic, and we've talked about that quite a lot in our little steering group of partners from the NHS. So that is really interesting.
Yeah, the power dynamic that comes depending on who is responsible for delivering the project that is funded. And this also enabled a kind of different point of view for us, in that we laid our cards on the table and we thought, well, what did we want at the beginning of this? What were we going into it expecting? And on a very simplistic level, which I know a lot of cultural organisations possibly have, we can show you how valuable this work is to community health, waving at CCG whilst hoping, great, down through the CCG tunnel comes a nice big wad of funding that can secure that work at a population health level. But if we're considering the partnership mythology and the imbalance around that power of funding, we thought, well, do we want to be answerable to the CCG, as wonderful as they are, in terms of that evidence is going to need to be of a clinical nature, because they're funded by evidence that needs to be from a much more clinical or medical model of health. And that made us think, so do we want to be led by and solely funded by an organisation that will be calling for that kind of evidence? And that made us think, maybe we don't want what we thought we wanted.
But also what became apparent very quickly is to get to that kind of pipeline, especially around here, is going to take a really, really, really long time. And it's, so it becomes more of a partnership odyssey as well as a partnership
journey.
As well as partnership mythology, and it's an ongoing journey, and it's a very, very interesting one.
And you'll notice we were talking about evidence, and how we wanted to consider how do we as a partnership decide what's valuable and why, rather than that decision being made from the funders. And you'll see Ruth has popped up a music and health paradox. So this will slide us into our next theme, which Ruth will tell you a little bit about.
Thank you. Yeah, it was really interesting to what I suppose the hook for this next bit to talk about the theme of music health paradox, which just in its simplest term is there was contrasting but also possibly conflicting perspectives and perceptions about what music was meant to be doing in this context, and what it meant to be musical towards challenging health inequalities and promoting and contributing to good population health or healthy public. It was interesting when Nell myself were analysing the interviews, this notion of a paradox came through probably because of how passionately music's value was identified across everybody that we spoke to within the partnership, but perhaps in different and sometimes conflicting ways, just even in the narratives that people had of their own roles in the project. And as the online event kind of outlined later on, it was centred on a belief that music is unquestionably good for you. Whilst also, as you might imagine, there was actually a lot of questions about if it was, or how it was, or what this meant in practice across the partnership. So there was this, we recognised quite early on and thought about it together through our discussions, that there was this kind of wrestling all the time with this really powerful belief in various kinds of qualities that participating in music may contribute to, but also this sense that it's got to be proven in some kind of very particular way. I'll speak about that in a second. But the relationship between music and health moved between music as health, so music in itself is healthy. Music in health, music has an important role to play in health interventions, and then that music is part of healthy living, so that music can be part of a healthy life with people and place in negotiation. And as we outlined in the position piece, and somebody asked me in the chat, is the literature review available? There's a condensed version of it in the report that we're going to share, and we hope to make the whole thing available at some point when we write it up in another format. But yeah, as we outlined in that, this isn't new within the context of understanding different ways that value is positioned in cultural work. However, despite this, it was playing out for More Music and their partners in real time, and possibly contributing to unhelpful assumptions about the role musicians are perhaps meant to have in the context of challenging health inequalities. So despite this, it was also, although it was challenging, it was actually really helpful for us to be thinking about how influential that role of the music leader is. And one of the really important findings that contributed to these themes in the interviews was that music leaders themselves were modelling strategic influence through the music project. And in many ways, they were supporting understandings of the ways that making music might have value as part of healthy living, and they were supporting partners to communicate this strategically. So at times it was presenting some tension between the priorities for project delivery and the project development that Kathryn and Anna have spoken about, and particularly regarding the project's long-term aims. What kind of project did this want to be and why? These ideas also held tension within us as a research partnership, where, as somebody who, for myself, joined the project wondering about how we face towards challenging or unjust context within our practices, I had a lot of thought on this idea that music might be unquestionably good for you. But as to, did the partners, through a really strong embodied sense of the value of taking part, and as Karen mentioned, as we were coming back into the groups, being able to see firsthand how the dynamic of the group changed through the experience of taking part. And that experience of taking part is really important to highlight and holds together all of the findings from the Working Together research project. And it was clear that there was a distinction between the value of evidence and the value of experience, which was contributing to this idea of what we're meant to talk about in regards to what the project's value might be and why. And a lot of it was held up in this idea of what was meant to be valuable. So when we spoke to people participating, the practitioners in the project, music leaders, partners, everybody was really clear about these unexpected outcomes that took part through the experience, and that the evidence was for policymakers. Evidence was having to fit essentially the square peg round hole situation that didn't do justice to the kinds of experiences that were happening on the ground, or required perhaps narratives that didn't quite fit with what was happening. And so these were the kinds of these are the kind of things that came up when we asked people about this in the online event. We're asking what contributed to the distinction. It was things around about the validity of the evidence that we were expected to collect. That evidence was just seen as a separate part of what people's musical experiences were. Really tricky things that through our work, we started to think that music leaders probably have really important, and practitioners more broadly, have a really important role in bridging. And in that way, I'm going to hand back over to Anna and Kathryn to talk about this idea of a new way of working.
Thank you, Ruth.
Thank you.
Yes, that point about the role of the music leader is definitely something that we continue to be dedicated to, really, because the team here is obviously fantastic and steeped in the wonderful practice of community music. And there's a few strands that we want to take forward into this new way of working together, or as the third space, we're getting more comfortable with referring to it as the third space. But in particular, the role of the music leaders in the project. Through the interviews, it came back that the music leaders didn't particularly feel their role was strategic in any way or of any particular influence. But through the interviews, it came back that it clearly was in relation to the other partners, the charity partners, the mental health partners, and the NHS partners. What was interesting is that they were in a position of influence in how they were advocating for the work and representing the work and making other things possible.
Yeah, so we've seen some crossover between projects and services because of the influence of the music leader in one particular context, which has been really powerful.
Yeah.
Yeah.
And connected to that, which was an unexpected outcome in relation to where we might assume value is placed, or to use one of Ruth's research phrases, a plurality of meaning and value across the stakeholders in the project. Something very simple as part of the project, that we would send one of our musicians to join an NHS conference up the road, a regional conference, or we might send one of our musicians into an NHS staff team meeting. So it was relatively low cost for us, but through the feedback from the interviews, we found out that it was really quite high value at the other end. And was there a trick we were missing there in the role of the music leaders, in that could have been, that seemed to be reaching senior level managers in the NHS in a different way to how our project on the ground was. So that highlighted back to us through the critical research, a possible strand was identified that we may want to consider in project development that maybe we hadn't considered before. So that was really helpful. A couple of the other themes we'll take into new ways of working is the protected space. Do you want to chat a bit about the kind of protected space?
I think we talked about it a little bit earlier, but we've really valued and learnt that we want to take the kind of reflective practice that it runs through all of our work and use it in this project. And we have been able to trial this with our partners, and it's been really, really valuable. And I think they've really, really valued those conversations, that honesty, that discourse, and that ability to move things on together, really. Yeah, and I think that's proven good for all of our mental health. It's proven good for us to all develop understanding of people working in very, very different cultures, really. I think, yeah, so we're going to look at ways of doing that, look at maybe doing some shadowing and some more kind of direct knowledge exchange or work experience, so we can really understand how each other's organisations work.
Yeah, we're quite keen to continue that knowledge exchange, and in that protected, reflective space. And what's key is that we're in that together. So we're already, for the last funded year of this project, is carving out that space, because it's only in those times, really, we connect at delivery points in the sessions, but otherwise everybody's very busy. So if we can connect in those reflective meetings, that's where we're going to begin to look at something that can be both good evidence and of good experience that we would like to share from this project. And that's something that particularly the NHS partners at the moment we're working with are committed to, and that is going to take some time to find something that is strong evidence but we feel speaks of real true experience of the participants and the staff that have been in the room at the sessions. So those stories we tell and how to make sure they're very valuable to the future of the project.
Sorry, Anna. I didn't mean to so aggressively stop sharing there. I think I have a slightly twitchy finger.
Well, I know we do tend to go on, so maybe we need to
time to stop.
A little poke. I hope that's been informative to this stage of some of those learnings that we're still putting together, but the research has helped signpost us to some of those possibilities in terms of future project development that I don't think we would have spotted otherwise.
Oh, that's absolutely right, yeah.
That's great. Thank you so much, Anna, Kathryn and Ruth. Am I right in thinking that given the time that we have now, we might move to our song and then we will have a group discussion to reflect on those findings, and there'll be space for you to ask questions to Anna, Kathryn and Ruth. I'm apologising now for my sound. I don't know what's happening. I haven't been able to resolve it. But should we move to our song?
Yeah, we thought we'd offer you a little palette cleanser from our voices, and we wanted to share with you, thanks to Sian, who's one of our regular musicians at the Seagull Cafe, the social prescribing song, and this is thanks to Eric Worsley, who is one of our social prescribing link workers from Bay Medical Group. He's kind of rewritten the lyrics to "I'd like to teach the world to sing" to make it "I'd like to teach the world about social prescribing," and he brought it to us and shared it once. So Sian's going to sing her way through that, and if you like, I think the lyrics are going up in the chat, so feel free to keep yourselves on mute, sing along or don't, the choice is
Very
yours.
good for you.
We'll try and do a bit of backing singing, but enjoy the social prescribing song.
I'd like to teach the world about social prescribing, with wellbeing walks and online talks and all that it could bring. It's the real thing. I'd like to link the whole world up in perfect harmony, with primary care and third sector and all community. That's the song I sing. I'd like to find a place to meet where people could just be. I'd like to hold them in my arms and keep them company. It's what I'd like to bring. I'd like to buy the world some tech and get them on the net, learning something new and enable them to socially connect. It's an online thing. I'd like to teach the world to have compassion for themselves and show them how to spread the love and improve their mental health. That's the song I sing. That's social prescribing.
Did you have a go, folks? It's a nice, simple sing-along. So thanks to Eric for his reworking of that, I was going to say classic. Yeah, any of our partners, Angie and Karen, they know that one. They've been involved in singing that one along. But what's really lovely, of course, with Eric, one of our social prescribing link workers, it's great, and with Karen, who's also musical, to see them doing some of the creative collaborating as well with the group, which is just great.
Brilliant. So we've got some space now to come together as a group, and you might have some questions for Anna, Kathryn, and Ruth. Feel free to unmute or just give us a wave or pop them in the chat if you'd like to ask something. I'd just like to say thank you to everybody that's contributed to the chat. It seems to me that we've got a goodie bag of kind of reflections and ideas around partnership-led research there that's really valuable. So feel free to save that chat for yourselves, and we might dig into some discussions around those points now. But first, I just want to see, are there any questions before I go to that chat that anybody wants to immediately want to ask? I'm always embracing the Zoom tumbleweed. I quite like it. I've got one to start off with then, and this one's particularly for Anna and Kathryn. It was mentioned in the chat after one of the breakouts that there's a need to view the word critical as not negative. So how for you as a community music organisation do you approach that? How do you view the word critical, and how do you shake off kind of feelings of negativity as you go forward in research and practice?
I think when we think about critical, do we think about a critical friend? And suppose in this context, it's about, we saw Ruth and the researchers as critical friends. I mean, I think there was there's a deep level of scrutiny and objectivity, but I think you have to approach it not as a kind of, you have to approach it in a positive way, because ultimately we respond to that criticism, so we take it seriously. But I think it comes from a position, especially in this context, of kindness, I hope.
Yeah, I would agree. And I had like kind of an image of Ruth and the team kind of walking around our project with mirrors. So that's how I viewed it in my head, in that they're reflecting back to you from a different point what it is that you're doing. I don't see that as a threat at all.
You didn't feel judged in any way.
No.
And
I think that's evidence of good community practice and background as a community artist as well. It's a case of there's scope for different values and different ways of approaching thing, and that kind of freedom to go, oh, right, okay, so you can see it from that angle. And I think community practitioners are very good at doing that anyway, or being welcome to aha moments. So yeah, we've welcomed it, and I think that also came from having a relationship already built with Ruth and the ICCM to grow on.
I think that part about the relationship is really important. I think if I was outside of our environment and thought, oh, the researcher comes in and holds mirrors up around my work and then has some kinds of judgments or perspectives around it. It's really interesting, because it makes me think about, that question again around the positionality. It's like, why am I in that space with you? Why are we in that space together? And what does research mean there? And somebody in the chat, Jodie, I think I've noted it down quickly, I hope I wrote that down right, was just raising the point around ethnographic perspectives and the possibilities of that, and so what we haven't spoken about, because we actually joked to people, we said we could have had a little symposium of our own as a little learning event from this, because in preparation for trying to decide what to share with you from a really rich experience, we did a lot of critical thinking through that process. But we did a pilot together in 2019 that again was developed from the commitment and also the resource investment that More Music have committed to being a research informed organisation. And in that, we had actually suggested that there would be an opportunity to perhaps work with some More Music staff to develop some research techniques and undertake kind of practice-based and ethnographic approaches. That was obviously before our current COVID turn, and Anna and Kathryn, you might be able to articulate better than me, but I think at that point we thought, well, we're thinking about sustainability. We know we want to look beyond talking about whether a project has a particular impact or not, and that's how we ended up at the partnership. So that was just, I felt like I just wanted to come in, and I am very grateful for being able to hold up mirrors, but also to myself and what our responsibility is as well.
Thanks, Ruth. Now, do you want to come in with your question?
Well, I just wanted to follow up from this idea of critical being seen as negative, having negative connotations, because it just reminds me of an event last week, the Centre for Cultural Values online event launching their evaluation principles. I bet some people in the Zoom room today were there, but one of the presenters told this lovely story. He's a sort of senior leader in the BFI, and he told this wonderful story about early in his career, he was an engineer in the aviation industry. And he said something like, in the aviation industry, it's considered really bad when a plane falls out of the sky. And as such, there is a questioning culture within the industry that he hasn't found in the cultural sector, because they have to be constantly questioning and improving and making things better. And he felt that within the cultural sector, there is this questioning culture. And I've been thinking a lot about that in the past week in terms of different aspects of my work. I would agree, I think, within the cultural sector generally, there isn't a strong questioning culture, but within community music, I think there is. I think there can be. Because I think as musicians, we're constantly questioning, is this good enough? Do we need another rehearsal before the next gig? It's sort of, I do think it's part of the culture. So yeah, two thoughts there. Critical connotations of it being negative, but yeah, maybe there is a time to move away from that kind of language to something more about a questioning culture.
Yeah, that's really good.
Great, thank you, Nell. And also, Robin Dowling from the Centre for Cultural Value has just popped a link in the chat for those interested in developing new critical partnerships for a new, I think it's fund that's been opened, so do check that out. Are there any more questions before I ask another? A few. Lucy or maybe Angie, did you want to talk about the comments that you popped in the chat?
Yeah, I was just quite interested in what you were saying about it's that sustainability. So it's great working with researchers, but what happens to those kind of skills when they leave and you're by yourself? So we had some really good ethnographic training from ARC Research and Sheffield Hallam University. I think Pete Nelson is here on this call as well. And that's been really interesting for us, not just on the Spirit of 2012 funded project, but we started using that across some of our other projects as well, with children and young people in special schools. So it's always, I think we're always doing that. We're always trying to find ways of improving our practice and improving our reflection. And I think there's stuff we could learn from kind of research that will allow us to do that. And we'll never do it to the same level when we know we're not trained in that, but we can get to a stage where it's useful for us in terms of what we want to find out.
Great, thank you, Lucy. And you mentioned, Anna and Kathryn, that one of your first partnerships was with the funders of the work that you continue. And as a community music organisation, I was just wondering, seems to be every time I talk, it jingles, if you could talk about kind of the funders' response to you engaging in partnership-led research. And maybe you might want to touch on, there's been discussion of power in the chat, and there'll be lots of kind of different pools there from the different partnerships that you've got. If you could just talk broadly around that.
I think the funders were very committed to research before Anna came in post, and when we did the first application, and actually on both occasions we were funded kind of twice. We did a pilot with the Music Challenge Fund, and then we got extended impact funding, and each time they asked us to increase the budget for research. So I would say that Spirit of 2012 are really, and I think Rob's on the call actually from Spirit 2012, and I'm sure that Lucy would agree. Spirit 2012 are really, really interested in research. It's a key part of their mission, I think.
Yeah.
Learning, they're a learning and a curious funder, and they want you to try things out, they want you to test things out, and they want you to investigate the things that you're testing. So that's been really, really good, and they were very accepting. We when we came to the second part of research, as we said earlier, we didn't want to necessarily go down that road of demonstrating again that music is really good for people in communities, or good for anybody for health and well-being. And it seemed to us the partnership was the most critical thing. And again, I don't think there's been much work around that. So they were very, very supportive of our move towards that.
Mm-hmm. And I was just thinking about this it might be worth mentioning the 3 different partnerships when you're talking about different relationships or different partnerships that we're trying to broker. Spirit as a funder is very understanding and supportive of that and those differences. The one I suppose we mention, not necessarily most, but that is most prominent possibly in the research, is with our partners in NHS, because that seems to be moving in the not strongest direction, most joined up direction at the moment. We had another partnership which is through our young people's mental health group, which was originally with CAMS and a really strong clinical psychologist called Kat Taylor, who's involved in other great work in Manchester. And so our partnership there was with CAMS, but they had a restructuring that it's now with ACE, which is another young people mental health support charity in the local area. So that kind of had to then start again in year 2. So you're reinventing and you're rebrokering new relationships. And our other partnership project is with another charity. So it's a charity working with a charity to kind of co-deliver
support services.
Services, and they are generally less supported and less funded than we are, less resourced as a community music organisation. So there's 3 very different kind of, ecologies there in
definitely.
which to grow partnerships and develop sharing of power.
Thank you. And we've just got about a minute left on the call, and I wanted to do some sharing. But Ruth, did you want to add anything to that before we stop? Or
all I would say is it was really nice in the breakout to read the comments that are in the chat, and thank you for people for taking the time to do that. I've made a few notes of things, and they really resonate with the learning process that we are going through and thinking about what these kind of partnerships can do. And lots of the words and ideas that have been shared are very resonant and alert in our work. That's it.
Great. So Nicola's just shared with you all some next things coming up from ICCM. I think we should also, would you like to share the report in this meeting, Ruth, Anna and Kathryn? Should we add that into our chat? Brilliant. And we will also email you that, so you've got that in 2 ways there. Somebody was asking for the working together report that has been discussed today. So ICCM, our next event coming up is in person, very exciting, on the campus at York St John University, and it is the 6th annual Student Symposium. Kathryn was going to tell you a little bit more, but has had to leave, unfortunately. So I'll just say that you can find all the info about it through your link there. It will be looking at the themes of positionality and the role of the researcher in community music research and music education research. And tickets are available to book now. We've got a wonderful group of researchers ready to present their ideas, and it's always a really welcoming and warm event across 2 days where you'll get to be around fellow researchers and discuss and flesh out ideas, particularly those of you embarking on PhDs. Our online events will resume from January. We've got 3 from January to May. I'll email you details about those. We'll have the wonderful Kathleen Turner from the Irish World Academy presenting. We've got a collaborative event that will be looking at anti-racism with a number of organisations internationally, and we'll have an event that looks at the intersections between music therapy and community music. As always, the recording will be available on our YouTube channel. Thank you all so much for coming and for your contributions today. And if you've got any follow-up questions, you can email us and be in touch. And I think I've said everything I need to say, except a massive thank you to Anna, Kathryn, and to Ruth for their wonderful presentation today. So you're very welcome to unmute and we can have an audible round of applause or shake hands, but it would be great to congratulate and thank you today. Thank you to Sian for the wonderful playing, Sian. Brilliant.
Sian can play us out as well. So as you disappear or give us a wave, Sian can play us out.
Great, yeah, Sian, we'd love to hear.
It was wonderful. Wonderful, thank you.
Thank you.
Show me the way to go home. I'm tired